how important is medical insurance, especially for international patients?
Medical insurance, firstly, we have to you have to understand what medical insurance is. Medical insurance is basically based on risk pooling. So it is our own money that is basically used to, treat us. So what we do is all of us, when we put some
Right.
money, and whenever any of us needs that money, he uses that money. So it is not nobody is
Correct.
doing it's a privilege that is earned by all of us, and not it's not that somebody else is giving to us. So that is what the principle of medical insurance is. So the first thing, so Neeraj,
Right.
let us do small little questions and small answers. So what is the first question that your viewers would like to know?
My international patients would like to know, since the cost of treatment is very high, how medical insurance covers and mitigate that risk.
For international patients, medical insurance is something which is vital. Not only so, let us look at medical insurance from a different angle, that what are the different aspects, what are the different advantages of having a medical insurance. Most of us think that having a medical insurance basically just covers the expense if we go to a hospital. So, for that matter, if I am a doctor, I think, okay, initially doctors used to think, okay, fine, I'm a doctor, why should I get my medical insurance now? The government employees, they thought that, okay, we are covered in the government, we get reimbursement from the government, why should we get it now? Now we have realized that
Correct.
you may not be the only person who may be treating yourself. You may need some other specialist in some other state. You may have to, and so the first and foremost thing is that a medical insurance ensures that the money spent in the treatment you get back either in form of reimbursement or in form of cashless. So this is the basic thing what medical insurance does. Okay. So apart from that, what
Correct.
other things medical insurance does is, medical insurance, there are medical insurance or there are policies which can cover your family. There are medical insurance policies which can cover even your parents. So if there is a group medical
Right.
insurance, you can even get your parents insured. So if
Okay, that's right.
if there is a society, so if you are working for a company and there are 500 people in the company, if the whole company
Mhm.
comes together and says, fine, we want to get 500 families insured, the insurance company gets
Mhm.
500 clients together, and at a reasonable rate, they would be ready to even insure your patients, parents, who may be 60,
Mhm.
70, 80 years old, who may not actually get an insurance otherwise, and you may get insurance for diseases which are normally not covered in individual policy. So this is what group insurance, or sometimes it's called as the job insurance or corporate insurance. This is the magic of group or corporate insurance. So
Mhm.
moving on from here, the third thing is, a lot of countries in the world will not allow you to travel unless and until you have a medical insurance. So you should have an insurance in which you can get a medical cover overseas. If you are not traveling, then you should have a add-on where your policy can get or you can get an add-on policy. So if you're traveling very often, then you'll have to have a permanent policy which covers overseas treatment also. Or if you are living in a country where you think that most of the treatments you'll have to go outside. Then it is very important that you get a overseas insurance policy where your overseas things are also covered.
What all companies provide international healthcare insurance, and up to what extent do they get the cover?
So see, there are lots of international, most of the international insurance companies. So there are three segments here. If you understand three segments here, so there are international insurance companies, giants like AXA or Prudential or Bupa. These are international agencies which are there. International insurance companies are there. Now these insurance companies, they have normally have tie-ups either with Indian insurance companies, the government insurance companies like Oriental Insurance or New India Assurance or New India Insurance companies, or they will have a tie-up with the HDFC Insurance or Max Bupa Life Insurance. These kind of people they have the tie-up with. So you have to look at what insurance you are buying and what kind of tie-ups they can offer. These insurance can offer you in the world. So if somebody is living in say Middle East in Oman, then he has to see that does his insurance cover. So if the preference from from Middle East, people either go to Germany or they will go to Singapore or they will go to India. So not each and every company will have a tie up with all three. So if the preference, say from Oman, more people come to India. So from Oman, if you have of a company that covers hospitals in India, then you have to go with that sort of company, or you have to have an add-on cover of the other company, which is also possible that two companies come together and you get an add-on cover also. So you have to explore either on the net or through people, or you have to talk to people, and there are several products which are available via your insurance companies which cover international.
Now, another important question that my viewers would like to know is whether these insurances they cover pre and post illness cover as well, sir.
Yes, again, you have to understand that different insurance. So insurance is a step ladder kind of thing. It depends upon what step of the ladder you are standing. Some steps are lower down and some steps are higher up. So most of the insurances across the world would not insure you for pre-existing diseases. So whatever pre-existing diseases are, it is very, very important that you insist that there is a health checkup done for you before you take the insurance. Don't take an insurance online without a health check. You have to insist, and when you insist on a health checkup, on a blood test, one, the advantage is you get your basic health check done, so that if there is anything, the whole point of getting the insurance is to stay healthy. You don't want to consume your insurance, you want to stay healthy. So what is the harm in getting a full body checkup if your insurance company is paying for it? So insist on getting a health insurance where you get a examination done. So second thing is, most of the chronic disease, most of the elective diseases. When I say elective disease is something, or chronic disease is something which is usually there in the body for more than 6 months, and or if it is left for 6 months, it will not cause you any harm, like a hair transplant, like a cataract, like a joint replacement, like a gallbladder, like a hernia, like a spine problem, like bariatric surgery. So these will not probably cause any problem, and most insurance companies understand that you can't get a 10,000, 1,000 or $5,000 insurance and then take a treatment of $30,000. So you will have to at least wait for these kind of things at least to be covered for 2 years. Most of the other things like cancer, like cardiac, like trauma, like tumors, these things are covered almost from day one in most of the insurance companies.
How these insurance help in getting medical checkups, kind of tests, or are there any free tests available which a person can go and get done?
There are two kinds of insurance policies which are there in India, and different policies they offer. Uh, Different companies they offer different. So, according to the income tax law, up to 5,000 rupees is exempted in case if you get your checkup done. One. Second, lot of policies are there which offer you a yearly check. Lot of policies, on the other hand, will give you, depending upon the amount insured, reimburse you or reimburse you for the health checkup that you do yearly. So, any which ways, any income tax paying can take an advantage of up to 5,000 rupees in income tax. If he is insured, he can either ask his company to reimburse, or if the policy includes free health checkup, he should take the option of free health checkup yearly. So all these three things are open in the Indian scenario. The world over it varies. So New Zealand, for that matter, will not grant a citizenship to anybody who is overweight or who has a BMI of more than 40. This is very, and they want their citizens to be healthy. So a lot of their laws favor healthy people. A lot of their schemes also favor healthy people. So a lot of countries are motivating people differently to get their health checkups done with or without any.